My name is Dr. Okafor Chidumeje, CEO of OurDrKing Foundation Nigeria, convener, treatathon, the lupus day, the lupus day, the lupus day. My name is Dr. Okafor Chidumeje, CEO of OurDrKing Foundation Nigeria, convener, treatathon, the lupus day. I want to give you a short story of an event that happened almost about 3 decades ago. But before I start, I would want to drop a word of advice. Please, before you call anybody's name, make sure you heard the name correctly and make sure you pronounce the name correctly. Because had it been the lady, this particular lady I'm talking about now, heard my name, allowed herself to hear my name correctly and pronounce it correctly, all these unnecessary events that cost me a wonderful, beautiful night wouldn't have happened. Even at that, I still feel this lady's problem, and the problem of virtually everybody in this story, is that they are suffering from what I call hearing loss or deafness. So before I start this story, I want to tell you what is hearing loss or deafness. So when do we say that an individual has normal hearing, that is, hears normally? So in medicine, we say that an individual hears normally when the least noise the person can hear is less than 20 decibel. That's from 10 to 15 decibel. That is, the least noise a person can hear is less than 20 decibel. We say that person hears normally. So what is now hearing loss? Hearing loss is when an individual has a reduced ability to hear sounds that other people hear normally. That is hearing loss. What is deafness? Deafness is an inability of an individual to understand speech, that is spoken words, by hearing. That means you are speaking and this person cannot understand it by hearing. Even when the sound, that is the sound of your speech, is amplified, the person can still hear it. Profound deafness is when there is complete absence of hearing. So now, what are the stages of, what are the types of deafness? We have conductive deafness. Conductive deafness means when the problem is with conduction, that is, of course, sound comes from outside, goes from the external ear through the inner ear through the middle ear to the inner ear. So if there is anything obstructing the movement of sound from outside through this pathway, it is called conductive deafness. The next one is sensorineural deafness. Sensorineural deafness means when the problem is mostly from other things that are not structural, like inside sensory nerves, vestibulocochlear nerves, very loud sound, all those things. So mostly sensorineural deafness is permanent. The next one is mixed. Mixed means the person might be having both sensorineural deafness and conductive deafness. Of course, these things are tested with tuning fork. The next and the fourth type of deafness is the one we call auditory neural spectrum disorder. Auditory neural spectrum disorder. Here, the person hears normally. The person hears very, very well. But the problem is that the sound the person hears cannot be transmitted to the brain for processing. So the person can actually differentiate sounds. The sound of your speech and the sound of a gun sounds the same to the person. So now, what are the levels of deafness? We have mild deafness, mild hearing loss. Mild hearing loss is when the least sound a person can hear must be from above 25 decibel to 41 decibel. Decibel is just the measure of sound. It's used to measure sound. It's the unit for measuring sound. The next one is moderate deafness. In moderate deafness, the least sound the person can hear is from 41 decibel to 60 decibel. The next one is severe deafness. The severe deafness, the least sound the person can hear is from 61 decibel to 80 decibel. Then profound deafness. Remember, we explained profound deafness as complete absence of hearing. That is complete deaf inability to hear. That one is whenever the least sound the person can hear is greater than 81 decibel. So now the next thing is, what are the likely things that will cause deafness? The likely things that will cause deafness is things like autosclerosis, ototoxicity from drugs like aspirin, aminoglycoside like gentamicin, anti-cancer drugs, quinine, that's anti-malaria quinine injections. Then we have viral. Viral causes include cytomegalovirus, that's the one that normally causes congenital, that is, it will start from birth. Then rubella can also cause congenital, excuse the one that has rubella virus. Chickenpox can also cause something like that. Then other causes are very loud noise, physical trauma to the brain or to the head, acoustic neuroma, Meniere's syndrome, Meniere's disease. So these are the usual causes of deafness. So now let me not go into this story. So look at what happened. A few days ago, about 3 decades ago, I went for a program. And in that environment, there are 2 halls. So we are occupying 1 hall. And in that program, I needed to be with a girl. So I had to tell the people in the hall that I needed to go and search for a girl in the hall, a girl. So I now went over to the next hall and saw a girl there. So I went to the girl and told the girl that I would like us to go I want you to go with me to this program, because it's like they actually came for another program. I didn't know the program they came for, but I just saw the girl and liked the girl. So I was not telling the girl that I would want you to come with me to my program. So the girl was still dialoguing, was still being difficult, until a friend came and called me and said, "Hey, Dr. King, how are you doing?" I said, "Wow, that's good, I'm okay." So the girl now turned to me and said, "Oh, really? Are you a doctor?" I said, yes, I'm a doctor. So the girl was now about accepting to go with me. Suddenly, a woman that has been standing in that program and talking came over and started started saying that, we have a pastor here and we've been looking for who will lead the worship. So as she was saying it, she was coming closer. She now said, "Didn't I hear somebody called a pastor, a Pastor King?" So we looked at her and said, no. Both I and the girl said it. We said, no. It is Dr. King. He said, "Yes, I said Pastor King. I just got it right. Please, Pastor, stand up and lead the worship." So I was trying to let the woman know that I'm not pastor, it is doctor. Each time I say doctor, she will repeat, "Pastor, I heard you say it right. That's Pastor King. I heard you now. I heard you the first time." She handed me over the microphone. So, and of course, as I was still talking, she said, "The band will lead you." And the band has already started playing. So I now joined them. I started saying, "Have your way, Lord, have your way, Lord, have your way, Lord, have your." So I started singing. So I thought maybe the worship will get like maybe 10 minutes, 20 minutes. You know the typical worship now. When I'm about ending the song, the woman will bring up another song. When I'm about ending this one, the woman will bring up another song. I said, what is all this now? You just called me to come and lead worship. You're not the one who's still initiating. Allow me to end the worship. This woman refused to allow me to end the worship. So I continued. Then, as it was getting to like 30 minutes, the girl's father came in. So the girl now looked at me and waved to me that it's not possible for her to go with me anymore, that there's no how. So I now said, "Oh, really? You can't go with me anymore." I now continued the worship till like 3 hours. Since they want worship, they were now begging me to stop. I refused to stop. I continued the worship till about 3 hours. So now, all these things wouldn't have happened if that woman had listened well to know that my name is not Pastor, that my name is Dr. King. So that is why I decided to teach you people hearing, because I think this woman is deaf. If not, I kept repeating, I am doctor, but she kept saying, she kept calling me